Hello, my name is Jessica Crimaldi. I'm a nurse practitioner working at the Cleveland Clinic in Cleveland, Ohio. I've been working in GI and hepatology for about 10 years, and I am part of the GHAPP MASLD Community Network. And I'm going to be talking today just on a couple of common questions related to MASH and MASLD and LFTs in general. So I'm happy to be here today and go over some of these thoughts and questions. So the first question that we got was surrounding what specific patterns of ALT and AST elevation should prompt an APP to initiate a workup for MASH or MASLD, especially if the patient is completely asymptomatic and doesn't have any, liver, GI, kind of abdominal related concerns. So the most common elevations that you're going to see with somebody in MASLD or MASH are what we call a hepatocellular pattern, or a pattern that indicates inflammation or irritation in the liver. So we commonly see that with elevations in AST and ALT. Typically, they're not going to be above more than twice the upper limit of normal, but that is not a hard and fast rule. But if they're getting above the 2 times upper limit of normal, you may just want to, do a double check on what you're thinking about. But it could be higher, but not always. If you are seeing elevations in the T-bili or the alkaline phosphatase, it could be related to MASLD and MASH, but it's not so common. Particularly if the T-bili is elevated, I would be more concerned that they're having more advanced scarring or fibrosis or even cirrhosis, because T-bili is one of those measures of how the liver is functioning or how the liver is doing in general. Alkaline phosphatase, I have seen some mild elevations in MASLD or MASH, but typically not significant. And then if you have T-bili and alkaline phosphatase elevations together, I would be concerned about a potential biliary or cholestatic issue or potential bile duct obstruction that kind of takes you down a separate pathway. So in general, we are going to see AST and ALT elevations in patients with MASH or MASLD. Also, there is a ratio we can do, the AST over the ALT. If that is about 2-to-1, we will also be thinking about, is this patient drinking excess alcohol? And that can be one of the ways that we screen for that. Beyond AST and ALT, what other labs might we think about? So we can also see a GGT elevated. And then you want to think about non-liver specific labs. So do they have, specifically for MASLD and MASH, do they have an elevated cholesterol level? We're looking at triglycerides most specifically, LDL. Do they have a low HDL? Do they have an elevated hemoglobin A1C, which may indicate pre-diabetes or in fact diabetes or an impaired fasting glucose? And again, if you're seeing that T-bili and ALK phos elevated, not impossible in MASH or MASLD, but you do want to be thinking about potential other etiologies and working through that. So liver function test elevations in general, how do we work through them? So if you're getting results back on a patient, especially, asymptomatic patients, it can be hard to know where to start. So I like to use a test called the R factor calculator. To do this test, you just need the patient's ALT and the upper limit of normal for ALT at the performing lab. So every lab may have very slightly different numbers. So you need the specific number or reference range from where that blood was taken. And that'll be on the report. And then you also need the patient's alkaline phosphatase. And then again, the upper limit of normal for alkaline phosphatase at the performing lab. You plug in the numbers, and there are R factor calculators online that you can find that are free and easy to use. And you will get a score. Less than 2 indicates a cholestatic pattern or a cholestatic injury. And that should prompt you to think about bile duct issues, things like choledocholithiasis, when patients have a gallstone stuck in their bile duct, or things like PBC, primary biliary cholangitis. The second score you can get is between 2 to 5, which is a mixed picture. So that has features of the cholestatic or bile duct problems, as well as hepatocellular inflammation. Things that fall into that bucket would be like viral hepatitis, autoimmune hepatitis, things like that. And then the third score you can get is greater than 5, which is hepatocellular. So that is also, again, viral hepatitis, can also be things like MASLD and MASH with that predominantly AST, ALT elevations. There is also, if you look at the American College of Gastro guideline on elevated liver biochemistries, they have a really nice way to approach, if this is elevated, think about this. If this is elevated, think about that. So I would try to do it in a systematic way, but generally speaking, when I see a new patient that has LFT elevations, the R factor is one of the first things I do just to get my thoughts of, this is where they're falling. This is what the pattern would typically indicate, and that's going to drive your workup. For example, if you have a patient that gets a less than 2 in the cholestatic, you're going to start with a right upper quadrant ultrasound, or if you already have a abdominal CT. I work inpatient, so a lot of patients will have a CT potentially from the ER on admission. You're going to be checking to see, are those bile ducts open, or are there any concerns about bile duct abnormalities that could indicate, why their T-billy and ALK phos are up. And kind of the last question, we want to talk about the role of serial LFT monitoring in managing patients with MASH that are undergoing either lifestyle or pharmacologic interventions to help treat that disease, and what changes signify response or disease progression. So as you might suspect, if you have a patient with MASH and they're able to lose a significant amount of weight, such as, that 5 to 10% range, and then you bring them back and you get updated labs after they've lost that weight and potentially sustained that weight loss for some period of time, you would want to see that their AST and ALT are coming down. I will say that with one caveat. When the liver becomes very scarred, fibrotic, even cirrhotic, it does not have the ability to get as inflamed and to produce an elevated AST and ALT. So in general, a reduction in the AST and ALT in somebody with MASLD or MASH who's losing weight and improving their lifestyle risk factors is a good sign, but we also have to remember that can also be a sign that the liver is just not capable of producing those elevations anymore, and they may actually be more fibrotic or even cirrhotic. It is possible to have a patient with cirrhosis or advanced fibrosis have totally normal liver function tests. And again, that's just because the liver is not able to produce that inflammation and those elevated numbers. But if the numbers are coming down, that is hopefully a good sign, and hopefully not meaning that they're progressing towards fibrosis and cirrhosis. And that's where looking at the whole picture comes into play. You also want to be aware that some of the medications that are available can produce LFT elevations, and what is the typical onset for those elevations, and do they maintain elevated, or do they eventually return back to their baseline and start to improve? So if you are prescribing a medication for the treatment of MASH or MASLD, just be aware of what to expect in terms of their effect on the LFTs. Okay, those were the questions I wanted to go over today in our podcast. Thank you so much for joining me, and I hope you found that helpful. Thank you.